Wonderful. Thank you and welcome everyone on this snowy, cold Wednesday. We're happy to have you all here with us. I'm Lisa Hinton. I'm the Executive Director and SVP for the American Heart Association in the Metro Chicago region. The COVID-19 pandemic has had a devastating impact both here in the Chicago area and throughout the world, as you all know. The virus can cause serious heart complications and strokes in otherwise healthy people, and patients with pre-existing heart disease and chronic conditions like blood pressure and diabetes are at an increased risk for significant COVID-19 complications. As an organization here at the AHA that's deeply concerned about improving health, the American Heart Association has been actively engaged in fighting the pandemic since its early stage. Now that the vaccines are rolling out, we know that there are a lot of questions floating around. We're excited to be here today with this incredible group of panelists to share what we know and answer any questions you may have. Before I introduce the panelists, a couple notes on how this will work. We're going to start with some questions for the panelists. Some of you have sent them in advance. Thank you for that. And some others we know we want to ask the panelists ourselves. And then we'll be able to pepper in your questions towards the second half of the session as well. So please do type those in the Q&A and the chat box. We'll keep a log of those and try to get as many answered as possible. When you are typing in the chat box, there is a little drop down and you can select who you're chatting to. So you can select all panelists and attendees or just all panelists. Make sure to pay attention to that so your message goes to the right audience. All right, now it's my pleasure to introduce our fabulous panelists. We have with us, and you can just wave when I introduced you, Dr. Donald Lloyd-Jones. He is the chair of the Department of Preventive Medicine at Northwestern University, Feinberg School of Medicine. He's a cardiologist and an epidemiologist, and we're excited to have him as our president-elect for the American Heart Association. Next up is Dr. Tochi Ekwuosa, who's the Director of Cardio-Oncology Services with Rush University Medical Center. She's also a member of our American Heart Association Metro Chicago Board of Directors and a member of our committee for Health Equity Advisory here in Chicago. We're happy to have Reena Shah, who is the Group Vice President with Pharmacy Operations for Walgreens with us as well. And then a special guest joining Reena is Jason Donica, the VP of Pharmacy and Retail Operations, who will fill in to help answer some of your questions too. And then we have Dr. Marta Renteria Mejia, who is the Associate Medical Director for International Health Management Associates, and also serves on our Health Equity Advisory Committee here for the American Heart Association in Chicago. Welcome and thank you to all of our panelists. All right, well, let's get started with some of our first questions. So the first one I'll shoot to you, Reena. Can you tell us a little bit about which COVID-19 vaccines are currently available?
Definitely. So we've been, hopefully the sound is okay. So we've been working closely with the CDC, with the federal government, as well as with the state and the city to offer vaccinations. The state, the city, and the federal government actually decide on which vaccine we would have in our stores, either the Pfizer vaccine or Moderna. And specifically in the Chicagoland area, as well as in Illinois, we're managing both. We're managing both the Moderna product as well as Pfizer. And then when Johnson & Johnson comes in, we'll be able to support that as well. So it is a combination of products, and it's really because inventory is so limited, what our goal is that our stores and our pharmacists and our technicians are set up to be able to manage both, not only for dose 1, but also to ensure the series completion of dose 2.
Wonderful, thank you. And Tochi, maybe you could jump in. Are these vaccines safe? Can you talk a little bit about that? I think that's what we get the most questions about. You're muted.
So from what we know so far, the vaccines are safe. Now, I know that people do get concerned. My patient population are cancer patients, and there's concern, cancer patients are immunocompromised, and is the vaccine safe? In the end, it is an RNA virus for both the Pfizer and the Moderna vaccines are RNA viruses. And what that means is that the vaccine, when they inject the vaccine into you, they inject the mRNA into the cell. And when they inject into the cell, it then codes for protein that makes the spike protein, which is the main protein that the virus attaches with. And so you're not actually getting the virus itself. What you're getting is the protein that's created by the messenger RNA that's been injected into the patient. And so if that's the case, we're not necessarily causing an infection in the patient. What we're causing is an immune response to the code protein that's been encoded. And so if that's the case, we're not infecting the patient. So generally speaking, the vaccine should be safe. Now, we all know that we have short-term data with respect to the vaccine because it was just developed. And based on the clinical trials data and based on what we know from the people that have been vaccinated since end of December/early January, including myself, the vaccine has been safe so far. Everybody's tolerated. Most people have tolerated it so far. Long-term consequences we're yet to find out about. We don't have that data yet, but so far from what we know, it's safe. It's so much so that the American Cancer Society and the NCCN are all recommending that cancer patients get it, even though they're immunocompromised. There are some group of cancer patients that are not allowed to get it right now, just two major groups. One are the people that are undergoing that have undergone stem cell transplant. They usually ask that you wait until about 100 days after stem cell transplant to give the vaccine. And then the people that have received cytotoxic chemotherapy, so chemotherapies that tend to kill the cells off. They're also asking that we wait for those ones until their cell counts recover. But it's not because of safety, though. That's the important thing. The reason why they're requesting that we wait on these people is particularly because these people, because if you don't have cells, you don't have you can't generate that immune response that's necessary to create that immunity to the virus. And that's the main reason why they're asking that we wait, not necessarily because of safety. So from what we know so far, it is safe right now.
Thank you, Dr. Tochi. That was really wonderful. Don, I'm wondering too, if you could elaborate a bit. I think what we hear most in some of the questions we've received too around safety is around the speed with which the drugs came to market. So could you talk a little bit more about the process and include as much information as you can on the clinical trials and the diversity of the population that the treatments were tested on?
Sure, thanks, Lisa. And I see some of the questions relevant to exactly what you're asking me, so I'll try to address a broad range of that. Let me just say, this is really remarkable science, and this is very trustworthy science that didn't just happen in the last year. We've had the building blocks to make this kind of a vaccine literally developing for decades. It starts with very basic biology. DNA makes RNA in our cells, which makes the proteins that make life possible. And so we've known that for literally 60 or 70 years. What we're doing is we're hijacking the cell's ability to make certain proteins. And what we're doing when we inject the vaccine, as Tochi said, is we're actually giving your cell the code to make this one specific protein that makes that allows this virus to get into your body. So you're not getting the whole virus. You're not even getting the pieces that could create a whole virus. You're just getting the machinery to create this one protein. And that one protein is what your immune system is going to respond to. So yes, these specific vaccines were developed in record time. It's a remarkable story. It took industry, it took academia, it took science, it took all our knowledge. But this is a huge success story for public health, and it shouldn't be viewed in any other way. Now, as Tochi pointed out, we got these trials done in record time. We still need to learn more about these vaccines, but it's crystal clear that these vaccines are very safe. The major complication is a little bit of soreness in your arm for a couple of days after. Very, very few patients have severe reactions to them. And in fact, they will ask you when you get the vaccine to stick around for about 15 minutes just to make sure you're not one of those very rare individuals. So, if you're fine for those 15 minutes, you're going to be fine. With the second vaccine, more people tend to have maybe a little bit of fatigue, not feeling great, perhaps a little chills or fever, but only for 24 to 48 hours. And that honestly should tell you the vaccine is working. Your immune system is responding. If you don't get that, it doesn't mean it isn't working, but some people just have a little bit more brisk response. So very, very safe is the most important thing we can tell you. But in addition, those trials show us that both the Pfizer and the Moderna vaccine, which work exactly the same way, are also incredibly effective, reducing the rates of severe infection in people who get the vaccine by 95% compared with people who got a placebo injection. So this is a remarkably effective vaccine in addition to being safe. And then to address that last question, Lisa, in the two big trials that we've seen published that got approval for the Pfizer and Moderna vaccines, about 10% of the people in those groups, roughly 3,000 in one trial and about 2,500 in the other trial, were of Black or African American descent as self-identified. Almost 20 to 25% self-identified as being of Latinx heritage. And so we actually have large numbers of individuals who volunteered to be in these trials. The efficacy was at least as good in those groups compared to white participants in those trials, at least as good, meaning better than 95% in some of those groups. And the safety was identical. So no reason to think that the vaccine is acting differently or less safe for any groups that are out there. We may get to this later. I'll just kind of put a teaser out there. There are some misinformation, I think, threads going on out there about whether pregnant or lactating women should get the virus. Probably something we want to address in a different question, but I think it's worth addressing just to make sure that everybody hears kind of what the current thinking is.
Wonderful, thank you. A quick follow-up to that too. Thank you for the breakdown too of demographics in the trials. What about the split of women and men? Was that pretty even as well?
Yeah, actually a few more women than men.
Wonderful. Thank you. Thanks, Don. And while we have you talking, I know, Tochi, you mentioned a little bit already about the vaccine and cancer patients specifically. Don, could you talk a little bit about the vaccine and if you'd recommend it for heart and stroke patients?
Yes, definitely the vaccine is recommended for heart and stroke patients. In fact, certain groups of heart and stroke patients are considered higher risk, right? That usually would make it into the category or the phase 1C group of people that should get the vaccine. And these are the people that have, heart disease, like, they just had a heart attack, or they have a coronary artery disease that's severe, or they have heart failure, or pulmonary hypertension. So some groups are considered high risk enough that they should get the vaccine sooner rather than later. So definitely it is safe in heart disease and stroke patients. And in fact, we're encouraging them to get it. And also if they have multiple cardiac risk factors like diabetes, hypertension, and a whole bunch of other ones.
Great, thank you. And Rena, maybe you can jump into, Tochi, you mentioned Group 1C. What does that mean? Rena, I mean, you're in the thick of this. Who's eligible to get the vaccine now, and what do we need to know about the rollout?
Yeah, you're right, Lisa. And it is complicated because, things are changing on a pretty frequent basis. So phase 1A, so what CDC did and ACIP said was vaccines going to be limited. And as, the rest of the panelists have said, it's been absolutely incredible, the science that has allowed us to get vaccine in our hands this quickly. Now, the research has been going on for 10 plus years, but the manufacturers coming together, the FDA, the EUA process, like all of these different pieces have lined up, and they were purposeful in lining up pretty quickly so that we can remove any of the barriers that would normally exist in a regular situation. So that is like kudos to all of the individuals that are engaged to help us get there. But even with all of that, there's been still limited vaccine. There's only, with production and whatnot, there isn't enough vaccine for the demand that's out there. So when you have that situation, we need to be able to manage those that are most at risk of morbidity and mortality. And that's what the vaccine allows us to do, is reduce hospitalizations and deaths. That's the goal at the end of the day. And so when the CDC and ACIP looked at the guidelines, long-term care facility residents and healthcare workers were at the top of the list, because in order for us to sustain the infrastructure, we need to make sure our healthcare workers that are reaching out to the patients day in, day out, they're vaccinated. And the long-term care residents are 40% of the deaths that we were seeing at the very beginning. So that was in phase 1A. So we're, pretty good. We've gotten enough vaccine to help support that. We're now in phase 1B, and this varies by state, and it actually varies by county. What's happening in the city of Chicago, so Cook County has different requirements than DuPage or Will or other counties that are out there. So you do have to understand exactly where you sit around that. And phase 1B is those that are 75 or 75 and above, those that are essential workers, ultimately, and other individuals that would be falling in that category. And then phase 1C is 65 and above, and then those that are 18 to 64 that have healthcare conditions, such as heart disease, diabetes, cancer, just as the other physicians have said on the panel. What we would say is that in Illinois, there's been a mix of it. It's phase 1B and C that are eligible. So right now, it's actually those that are 65 and above and essential workers that are eligible to get the vaccine. Starting next week, that group is going to continue to grow, and that group is going to continue to grow as there's more vaccine available. Once inventory comes in, then we'll be able to continue to expand the groups, get as many people vaccinated as possible. But we want to make sure that we're keeping the hospitals as safe as possible. And the best thing we can do is immunize those that are most at risk of complications. And if we can get those individuals immunized, and that's for all populations, especially people like in communities of color, individuals that we know that are hardest hit with COVID-19, those are, that's where our first priority is. And then the ones that we know that can manage through the condition, and when vaccine becomes available, we'll expand to that. So lots of moving pieces, and I can tell you it's not easy. It's extremely complicated, and I would thank everyone, because we know that everyone's having to be very patient as more vaccine comes along.
Wonderful, thank you. Could you share too, so if I did qualify, how would I sign up to get it? And maybe a second part to that question, how can I stay abreast of what phase we're on and when I qualify?
The local Department of Health has the requirements and eligibility that's listed on there. So that I would say, is your first resource when you look at exactly where you live, how you can look at the local Department of Health, the website that they have, or even calling them might be a way to get a hold of them. At Walgreens, what you can do is we can go online and schedule an appointment and when you schedule an appointment, it's like a air flight ticket or round trip that you would get. You get an appointment for dose 1 and you get an appointment for dose 2. And the intent of that is because we want everyone to ensure that they get both, because series completion is critical when we go ahead and get vaccinated. The biggest complaint that we get all day, every day, is there's not enough appointments. Every day the appointments are very limited, and that's around the Chicagoland area. But as we get more vaccine, we're increasing the number of appointments that are available online to make sure that we're able to support that. And if anyone has questions, we do have ways to go ahead and either leverage our store team members and our call centers. Like, we're helping patients navigate, but it is hard because appointments are limited in nature and they fill up pretty fast.
Thank you, very, very helpful. With questions in the chat too that I feel are a good follow-up to this. Don, maybe you can jump in and certainly if others have answers too. But so with the vaccine, is it going to be something that if I get it, I have to then get annually? Am I covered for life? How does that work?
Yeah, wonderful question. We are exposed, it should be noted, we're exposed to coronaviruses all the time. They are common cold viruses that are always in our environment. This particular one and SARS-CoV-1 and MERS, the ones that have come in the last couple decades, these are much more virulent strains of this type of virus. But we're gonna run into these coronaviruses, and this particular one is gonna be around for a while. We don't know yet. We know that for 90 days after you get the vaccine, you have really good antibody levels, and you should be pretty well protected from you getting a severe infection. After that, the antibody levels tend to fall off, and we need to learn more about just how good that protection persists, how well that persists, meaning if you're exposed again, how quickly will your antibodies ramp up to protect you against a serious infection? I think the betting is that it's likely that just like the annual flu vaccine, we're probably going to need something like an annual booster for this one for a little while, until maybe it goes away or goes away enough. But I don't think we know that for sure yet. So stay tuned. Certainly at the first opportunity you have to get your 2 doses in, I would recommend you get them unless you have a specific health condition that you and your doctor think it might not be appropriate for, but that should be very few people. And then stay tuned, and we may want to, you may want to get a booster shot at your year anniversary if that's what's recommended at the time.
Wonderful, thank you. Marta, I'd love to bring you into the conversation a little bit too, because we're hearing a lot about still mistrust and hesitancy to go get the vaccine. And I'd love for you to talk a little bit about that. What are you seeing in terms of resistance to getting the vaccine or hesitancy there in the communities you serve?
Sure. Overall, I can say that even though vaccine reluctance has been observed in several communities to different levels, communities with less access to medical care and services seem to have more distrust in vaccination efforts. From personal experience, as I have worked with some of the volunteer organizations in our communities, we see that a significant percentage of the most vulnerable communities are hesitant to get the vaccine. I am talking about our African American and Latinx communities. Unfortunately, the lack of access to reliable information and widespread misinformation that travel fast through social media has spread distrust in the medical community. According to the evidence, less than 1/3 of the vaccinated people in the United States belong to the Latinx and African American communities. That is a huge problem. People are scared and they don't have anyone to ask any questions. Think about it. If you don't have health insurance or a primary care provider, who are you going to ask? The CDC or Facebook? Yeah.
Yeah, great point. Great point. Thank you for sharing that. So along those lines, how do we rebuild that trust? How do we combat the hesitancy to help the largest number of people get vaccinations?
I think our efforts need to focus on meeting our community members where they are and increasing access to reliable information. This information should be easy to understand. Not all of us have the same level of understanding. We can continue to do this through efforts in social media, providing reliable resources for education to the people. According to data, more than 95% of the people have a smartphone today. So let's use it. Let's get the social media and let's get the reliable information on it. I think also healthcare workers can help promoting vaccination within their families, their friends, their communities, and that will be a great point. Another point can be to advocate for early access to vaccines to those who might not have the choice to work remotely, and that is a lot of population. Also, maybe making the vaccine available at places where the communities meet and gather, like churches, grocery stores, recreational centers, community centers, park districts, local pharmacies. And this is even more important in rural areas. Another initiative is to take the opportunity to address not only the need of the vaccine, but also other needs in the communities and social determinants of health. That creates trust. We also need to involve the leaders in the community. If they are on board, the communities will trust the vaccination process. We can ask them to take a picture and they get the vaccine and post in the social media. Let's use the social media for that. I think that is very important to do that.
Yeah, absolutely. I know I've seen some of that too. Do you have any other thoughts on how community organizations or health organizations like the American Heart Association can be part of the solution?
Yeah, the American Heart Association has an important role during the COVID-19 vaccination process in many ways. Education, as I said before, is the main goal. So people can understand that the vaccines are safe and effective. They have some adverse reactions. The main one is pain in your arm, but it's nothing serious and resolves in a few days. The benefits of getting vaccinated are excellent compared with a little discomfort with the injection or even a mild reaction in your body. The American Heart Association can also support initiatives that will take the vaccine to the communities. This can help eliminate some of the barriers that are in the way of people getting the vaccine, such as lack of transportation. And finally, supporting the providers around the nation with the necessary tools to inform and educate our communities at risk.
Wonderful, thank you. And we have a question that's popped up in the chat for you, Dr. Renteria. So often members of vulnerable communities don't respond to opportunities to get good information. How do you address this?
Education is the clue. I have several people come to me and I was like, where do you hear that? And they say Facebook, and I was like, that's not a reliable information. Go to the places where you can find reliable information or just ask me. So I was in the meeting last Friday and one of the, I forgot his name, and he was just telling, when people come to me, I offer the reliable information. Tell them, if you don't know anything, don't believe everything that Facebook posts on it. Just come to the reliable trust. So I think that's the way, just getting them the reliable information, education.
Wonderful, great. And maybe I can invite another panelist into the conversation too. How do we know if information's reliable or not? I mean, there are people we trust that share things on social media, and if it gets enough likes, it might seem good to us, but what can we do to make sure we're looking at reliable information?
I can potentially start, and then it'd be great to hear from the other panelists, because it's something that we combat every day in our pharmacies. Dr. Google has become another source of information, and Facebook, as you know, as spoken before, Facebook, Twitter, LinkedIn, Instagram, all of these are tools that can either benefit the conversation or it can hinder the conversation one way or another. And so, our healthcare professionals, our pharmacists that are in the field every day, all day, what we realize is that many of the times when there's especially a lack of access to care, it's our pharmacists that are leaned on to validate, is this true or not? And we've been experiencing this since the entire wave of having information at your fingertips, especially may it be Google, may it be all of these other sources. Our pharmacists do spend time educating patients about what feels real and what doesn't, and when do you go and validate. So it's fine that you go ahead and look across all of these different websites and do your own research. That's okay. But you want to validate the information that you're reading, and who do you go to validate? And that's your physician, your nurse practitioner, your pharmacist. All of the healthcare experts that live and breathe this every single day can tell you, you know what, that's not real news. That is something that you should look towards. And I think it's good for every patient, every customer to take ownership of their own health. It's great to make sure that you feel empowered to do that. The biggest mistake we can do, though, is believe that everything we see in front of us is actually valid. And so what we've been educating our team members and our patients on is that rely on your pharmacist, rely on Walgreens.com, rely on these trusted resources. CDC is a great example. Rely on these resources. And if you come across something that doesn't, you have questions on, ask us. We're accessible, we're around the corner. Just validate you feel something, that it's right or wrong, and we can help navigate appropriately. And I know I've done it myself with my own doctor. I say, I've read something, can you please help me understand, is this true or not?
Great.
What a great answer. You know, I'll add to your list, Rena, the American Heart Association. We've spent a lot of time over the last year vetting the science, understanding its implications, you know, for whom, when, why. And so we have a really nice COVID-19 resources page that can also be useful. But sure, I think CDC is a great place to start. They really have put it in very simple terms. They have a frequently asked questions page that I think addresses many of the things that we're seeing in the chat box that I hope we're going to get to as well. But, you know, I think there are sources of trusted information out there. You know, I think the more mainstream the media source, likely the more they have done their homework about what they're putting out there. Social media, I think, unfortunately, is unreliable, and word of mouth, oh, I know someone who may have had this. Well, you know, you just can't base your health decisions on that. You have to base your health decisions and your decision about this vaccine on reliable sources. And again, I think CDC is a great place to start, but all the other ones that Rena mentioned are really important as well.
Wonderful, thank you. Oh, go ahead, Tochi.
No, I was just going to say that I'll just add, I completely agree with Rena and Don and Dr. Renteria. I think the one thing I'm going to comment on is just remember, you know, you go to CDC website, you go to all these websites, some things are general enough that you can say, okay, how about my own specific health condition? And what about how do I get my own question answered? These days of technology, you know, we all have MyChart, you know, you have MyChart as patients. Send a quick MyChart message to your doctor and just ask, just to be sure, you know, ask whatever specific question you want to ask specific to yourself. And for those that don't have access to MyChart or digital sort of media for asking physicians questions, set up a visit, even if it's just a phone visit with your doctor, just to specifically ask them all those questions, or just ask your physician to call you. Because I know that some patients have questions that are specific to themselves, and that's important to be addressed as well.
Thank you.
Lisa, one thing that we didn't really talk about, we talked about the really important role, you know, and considerations for cancer patients. We didn't talk about heart patients. So if it's okay, I might jump in with that, right?
Go for it.
I imagine there are a number of people on the call who have some form of cardiovascular disease or have had a stroke. And I think those are really key questions as well. Just to remind folks that as horrible as COVID-19 has been, and of course it's been devastating, in 2020, calendar year 2020, we lost 375,000 Americans to COVID-19. We lost over 800,000 Americans to heart disease and stroke in 2020, as we do every year. So the focus needs to continue to be on maintaining your cardiovascular health. And that's important not only for avoiding or controlling heart disease issues, it's critically important for controlling COVID and making sure that you're not at risk for a severe infection, because the risk factors for severe infection turn out to be very similar to your risk factors for developing heart disease and stroke. Specifically, high blood pressure, diabetes, and obesity continue to bubble up as the three main risk factors for severe infection. Not on that list is existing heart disease or stroke. Now, if you get severe infection, having a heart pump that doesn't work as well, or having had a brain problem previously, is a complicating factor, but they don't put you at extra risk for getting a severe infection. It's those underlying risk factors, high blood pressure, obesity, diabetes. Those are the things that seem to be really important and may drive higher risk for getting that severe infection. So another good conversation to have with your doctor, how can I control those risk factors and mitigate any risk of me getting severe infection if I'm exposed to this? And of course, one of the best ways is to get the vaccine, especially if you're in one of those categories. The other thing I'll say that unfortunately we saw as a consequence of the COVID-19 infection, which is still ongoing, is people afraid to go to the hospital if they're in the middle of what they suspect might be a heart attack or a stroke. You can't delay treatment for those things. If you think you are having a heart attack or stroke, get yourself to the emergency room. All of our healthcare systems have done a great job of getting people in, getting them isolated, testing them, making sure that if you don't have COVID-19, you're in an area of the hospital where you're not going to be exposed, but all the protective equipment and everything will still be used. So do not delay. If you feel that you're having an acute emergency, get yourself to the emergency room. Unfortunately, we saw big jumps in both late presenting heart attacks and strokes, but also people dying who didn't need to because they were afraid of going to the emergency room because COVID was around. That's a huge mistake. So please, please don't make it.
Yeah, absolutely. Thank you, Don. You know, we've had a lot of questions too about specific and in the chat and whether the vaccine is safe for those. Perhaps another way to tackle this, and certainly I know you'll say go talk to your healthcare provider first and foremost for anyone who has a specific question about their own health or condition. But are there certain conditions or things that you'd say you really want to go check first if you have one of these? And kind of tackle some of those questions that way.
Who's going to jump first?
Yeah, I was going to say, I think Don mentioned it at the beginning about pregnancy and, breastfeeding after, because, I believe the majority of individuals are eligible and recommended to get the vaccine. There are some exceptions, as we mentioned before. And that's where those individuals with those specific exceptions, their physicians will let them know to go ahead and consult and validate that it's okay. And that's for all vaccines. In general, the majority of vaccines for the majority of the for the public is recommended. There might be some nuances that we screen out of based on that. But, Don, it might be good just to talk through, the pregnancy and the folks after pregnancy with breastfeeding and what the data looks like there, since that's actually a hot topic that I know we receive quite a bit.
It's a very hot topic, and it's an important one, obviously. There is a fake news thread out there. Some scientists noted that the coronavirus protein looks like a protein in the placenta and raised this very theoretical concern that there might be a problem with spontaneous abortions happening if you get the vaccine. It's entirely theoretical, right? Now, fair to say that pregnant women were excluded from the trials, so we don't have complete information. That said, there were a number of women in the trials who turned out were pregnant. They didn't realize it yet. And we did not see any vaccine-associated complications with their pregnancies. Small numbers. 2 women did have a birth complication, and 1 woman had a spontaneous abortion. They had both gotten the placebo. So it wasn't the vaccine that was causing that problem. It was unrelated and clearly something else. So I would say really important to get with your doctor. We think that the vaccine will protect you if you're pregnant. It's obviously important to be protected if you're pregnant. And even if you don't get the vaccine, to continue to do all the other things, the social distancing, the hand washing, the mask wearing, to protect you and your baby. Now, that said, same thing, women who were breastfeeding were not included in the trials. But remember that one of the main benefits of breastfeeding is transferring antibodies to the baby. So the baby whose immune system is not mature is actually protected because mom is giving them antibodies through the breast milk. So no reason to think that this would be a bad idea if you're breastfeeding a young infant, and every reason to think it will help protect them, actually.
Wonderful, thank you. Along those lines, the vaccines we currently have are not, were not tested or are not meant for children. I think it's under 16, if that's correct, at least for one of them. Is there anything coming for kids? I mean, how are we looking at this for children in the future?
I believe that trial is starting this week. So stay tuned.
Great, thank you, thanks. Wonderful. So going to the chat box, there were a couple questions about a side effect with Bell's palsy. That being a side effect from the vaccine and or it being reactivated in someone who's already had instances. Can someone speak to that?
I think the thing about Bell's palsy, they did find some Bell's palsy in some of the patients, but also found Bell's palsy in some of the patients that received placebo, if I remember correctly. So if that's the case, then I don't think necessarily that the Bell's palsy was associated with the vaccine. And what they also found was that for those that develop Bell's palsy, the rate of developing Bell's palsy amongst those in the trial was similar to the rate of developing Bell's palsy into the general population. So it wasn't much of anything to be concerned about, per se.
I think that's right. With standard flu vaccines and other types of vaccines, we do see a little small amount of risk that seems to be for Bell's palsy and some other autoimmune diseases, meaning when we activate your immune system, sometimes rarely, there may be a little bit of off-target effect, and the immune system starts to, go after other parts of the body when it shouldn't. We don't really know, but it seems to be a very, very rare, if at all, that this vaccine is associated with Bell's palsy. That said, and I saw one of the questions, if you've had 2 episodes of Bell's palsy, I would absolutely ask my doctor, if they think it's appropriate and safe, and what we might do, especially to monitor carefully for that. If Bell's palsy is caught early, there are actually good treatments to kind of dampen some of the effects and hopefully speed the recovery. So I think, that particular situation, if you've had Bell's palsy, particularly if you've had it to a vaccine in the past or a viral infection in the past, that's a great question to get with your doctor about. Absolutely.
And talking about immunity and immune reactions, right? A good example is cancer patients. Cancer patients, these RNA vaccines, like Dawn was saying earlier, the idea of using RNA that encodes for protein is something that we've always known in medicine for a very long time. Using it for vaccine is a relatively newer thing, but definitely before COVID, right? In cancer patients, they have developed, or in development and actually just coming out into clinical practice, cancer vaccines that utilize RNA as well for vaccination. And in those patients, some of them were actually on immunotherapy, which are also cancer medications that generate immune reactions in the body. And those that were on immunotherapy that received the cancer RNA vaccines, just like COVID RNA vaccine, were safe and didn't have any added complications associated with it. So again, that's also another thing that speaks to the safety of this vaccine.
Thank you. Thanks. So we're getting lots of questions. I'm glad that everyone's engaging in this conversation. I've seen a few of them about, if a person is vaccinated, can they still carry and spread the virus to others? So if I get vaccinated, along those lines too, can I stop wearing a mask? Can I start going out and being social? What should that look like?
So if you get the vaccine, yes, you can still get the infection, and yes, you can still spread it to others. Getting the vaccine basically means, what we know is that the risk of serious infection from the vaccine is way lower. And that's the reason why we're wanting people to get it. So, the overload to the healthcare system is much less, but you can still spread it. So we're encouraging people that get the vaccine to still wear the mask, to still carry out all the precautions associated with COVID-19, like washing your hands and keeping your social distance, because the fact that you can still get it is still a real thing, just that the infection is not going to be serious if you do get it.
Yeah, I think that's particularly true if you're more than 3 months out from the vaccine, where we can actually see occasionally people will test positive for having the virus particles in their nose. Now, we don't fully know whether those are infectious particles or whether they're just deactivated particles that you were exposed to and your immune system did the right thing with them. We can still detect them. But everything that Dr. Arquos has said is exactly right. Get your vaccine, get protected. It will help all of us if you're protected too. But you still have to do the mitigation things and the personal protective equipment, just to be safe and avoid the small but potentially real issue that you could still spread it, even though you wouldn't get sick from it.
Great, thank you. There's a question on here too that Don goes to something you said earlier, sharing very honestly that the medical and scientific community still have many unknowns about the short or long-term effects of the vaccine. So why, in the face of that, the question is, should people trust getting the vaccine? Yeah,
it's a great question, and I know the FDA wrestled a lot with this, and maybe Jason or I guess Rena's left us, but or any of the other panelists could address this. When we are faced with a massive, urgent, acute public health crisis like this, we know the things we can do that have worked out. The mask wearing, the hand washing, the social distancing, that helps, but it only helps to a certain extent. And facing the death rates that we're seeing, we have to do something to really tamp down this virus much more effectively. And that's where the vaccines come in. Even though we don't have perfect information, we will never have perfect information. What we as providers and public health practitioners always have to do is balance the risks and the benefits. The benefits, particularly of these two first vaccines, clearly outweigh any risks that we've seen to date. But that's an important qualifier. To date, sure. Could something pop up later? It's possible. But the way this biology works and the way that we understand, the immune system works, it's very unlikely. And that, with each day that goes by and the more people are vaccinated, and we're not seeing emerging things that happen now that millions of Americans have received this vaccine, is a day we're increasingly confident that these vaccines are going to work well and that they're not going to have longer term consequences.
Great, thank you. Thank you. And so another question, and this kind of goes back to the seriousness of the COVID-19 disease overall. But one of our attendees is asking, why a vaccine when it's documented that this says, quote, 90% or more people who get infected by the virus come out of it okay. So kind of, if you could speak a little to why vaccination is still so important and the severity of the coronavirus pandemic.
I could start, but I'd love to hear, again, maybe particularly Dr. Renteria, comment here too. But I think our job as a society is to protect our weakest members. Many of us on this call may be, very healthy, and even if we got, a symptomatic infection, we'd probably come through okay. But there are many, many people for whom this virus is deadly, and I think all of us need to do what we can do to make sure they're protected also. And that's where vaccination works, right? We know that the annual flu vaccine that most of us get is much less effective than these vaccines, often in the 60 to 70% range, but it clearly changes the shape of the annual flu vaccine epidemic curve, clearly. It works. This herd immunity concept really does work. And so, that's why we vaccinate, is that a very few small number of people will have a severe problem from this. It's not so few and small when you're talking about 450,000 Americans, it turns out. But percentage-wise, it's a smallish number. But we need to vaccinate as many people as possible to protect those few who, either because they have pre-existing conditions or because they have bad luck, get a severe infection and can be killed by it. And that's my view on it, but I'd love to hear what others think.
Mm-hmm.
I would like to say that, as Dr. Don say, the vaccination is just to prevent the deaths that we have been climbing by the beginning of last year and by our winter time, and also to prevent the severe case that fill out all the emergency units, not only in our country, but the rest of the world. So I think all of us need to work on vaccination, not only few of us. In our country, we're doing that. And as may you know, I'm from Colombia. So in our country, they are working in the vaccination as well. We have a lot of people that have died, close people, friends. We have and that was a breaking of heart for us, because we have a physician, an internal medicine doctor that lost his life after 1 year. He was taking care of himself, avoiding the people, masking, doing all the mitigation rules that we know, and he passed last month. And it was devastating for us, because you never know how you're gonna get it. If you're gonna get it just mild, or it's gonna be a severe thing. So it's for that reason that we need to do that. Vaccination is to prevent death and severe cases.
What a really important point that I completely neglected. Thank you for saying that, Dr. Renteria. We have come perilously close, really close to breaking our healthcare system. And when the healthcare system breaks because we are overloaded with really sick ICU patients from COVID, we can't help anybody. And I can tell you, many of my colleagues have just been working day and night for a year, you know, going on fumes. And it's not just the people, it's the infrastructure. We are, you know, when we go through these waves of infections, you know, we saw it in New York early on, we've seen it in Southern California most recently. We can break the healthcare system, and when it's broken, nobody gets care. And you know, a whole lot of other things will happen that are detrimental as well. And that's another great reason why vaccination is so important.
Thank you. We have a couple questions coming in, and Jason, I want to throw these your way. Can you talk a little bit about the logistics? So how are vaccine sites verifying that those coming in are in the proper phase to receive it? And then do you have any tips or suggestions, strategies for those who are trying to get appointments for their parents or relatives or themselves if they're in the proper group?
Yeah, thank you. It's a great question. My internet's going up and down a little bit. I think you can hear me okay, but it's a great question. I know it goes by state, the different eligibility requirements. As Rena mentioned earlier, even by county at times, by cities, et cetera. And so those eligibility requirements can change pretty quickly. Someone may decide, hey, we want to vaccinate 75 and over, or we want to do 65 and up that are healthcare workers, et cetera. So the way we're doing it at Walgreens is we're making sure that when you go online to schedule those appointments, there's an attestation, right? You make sure that you check off the eligibility requirements of that particular jurisdiction that you're in to ensure we are vaccinating those by which the vaccine was intended for. So that's how we're doing it. We're setting it up online as such. The same thing, even as they come into the store, we're doing the same thing as a double check to ensure they do meet those eligibility requirements. From the conversation around where do I find an appointment, certainly the demand is high. We know that. The moment we do get vaccine, it goes really fast. I mean, being very transparent, right? So we'll put appointments online and they're gone in a moment's notice. And it changes. And I know the question is, well, can you tell us when it's going to come online? And we're doing many different things. But the example of sometimes it might come in on a Tuesday or it might come in on a Wednesday. We're working very closely with the CDC. The weather that we're dealing with today is another great example of what can quickly throw a wrench in the timing of the supply, et cetera. But what I can tell you is our number one priority is shots in arms. And so what we don't want is we don't want these shots sitting in a freezer anywhere. And how do we make sure we're out there? Maybe to add to what was mentioned earlier too is, you know, the priority around getting to these skilled nursing facilities initially, where those complex disease states were. That was our number one priority, alongside, of course, the decision of the CDC. But I think ultimately going back to your local Department of Health, the CDC website, as far as different directions as to where vaccine's coming, and it changes. And I really wish we could say this is exactly when it's going to come and where. It just changes. It's very dynamic. There's no other way to say it. But we're looking forward to continuing that supply of inventory so we can get as many shots in arms as quickly as possible.
Wonderful, thank you. And questions about the second shot. I mean, both ensuring that people who've already gotten one then get the second, and then questions around what happens if I only get one and I don't get the second, if I don't finish the series.
Yeah, I'll of course let the medical professionals talk to the second part. I definitely have a little bit of insight, but we'll welcome their thought process on that. But our priority is to making sure they complete the series, zero doubt about that. So whether we're getting back to them, whether it's via phone or email, or we're literally not just an IVR message, but picking up the phone and reaching out to these folks, ensuring dose 2 is had. We're making sure you can't schedule dose 1 without dose 2 today. So if you go onto our scheduler today, it says schedule 1, and then you can't get dose 1 without scheduling dose 2 at the same time. So it absolutely is a priority. What we're finding is there are a lot of different entities out there that might be vaccinating and getting dose 1 into the arms of patients out there. And then they're coming to us saying, we still need dose 2 over here. So it's really striking a fine balance, to be very transparent. I think that the question, I'll touch it just really briefly. I know that the authorization of once getting vaccinated, I call it T+42. They've given up to another 42 days to be able to get vaccinated, whether that's the Pfizer or the Moderna, but of course would welcome our physicians online to add to that as well. Any comments?
Dr. Yep, there you go.
The studies actually for both vaccines, the Moderna and the Pfizer vaccine, did show that they didn't generate enough antibodies with the first dose. And that's the reason why they're giving the second dose to these patients as a booster shot to generate enough antibodies in the system. Now, that being said, you know, I think we all know about the Oxford vaccine that basically showed that people that got the lower dose did better than those that got the higher dose. I'm not sure what that means. I don't think any of us really knows what that means overall. But based on the clinical trial, based on what we know from the clinical trials, it makes sense that if we're generating more antibodies with the second dose, that everybody needs to get that second dose.
Great. And then I saw this question pop up several times. What if I had coronavirus? Do I have any antibodies already? Do I still need to get the vaccine? What does that mean for me?
So about 2 to 3% of the people in the trials actually turned out already had antibody. They'd been exposed to the virus and probably asymptomatically. But the current recommendations, I think, are sound, which is to say that if you've had a documented coronavirus infection, you should probably wait 90 days before getting the infection. And that's just, you should still get it. So before getting the vaccine, you should still get the vaccine. But because your immune system is already revved up a little bit, there might be a chance that you'll have a little bit more of a severe reaction to the vaccine until you wait the 90 days from your infection date.
Great, thank you. And this question made me smile. I have gotten the 2 vaccinations from Pfizer. How long do I need to wait to give my grandchildren?
Well, good for you. Awesome. You know, I think, you know, you have to look at your family dynamics. You have to look at who's in your bubble, who's in their bubble. You know, I think before large family gatherings are possible, you know, we really need to kind of think about all the potential consequences and, you know, the context that will come thereafter and all those people. So, you know, I think if, and I hope you can see your grandchildren, you know, if they can quarantine for 10 to 14 days before seeing you, if you can do something roughly similar, I would hope you could see them. I would still want you to wear your mask. I would still want you to, you know, to wash hands carefully, and they should as well. But it's better, certainly having you had the vaccine, it is better and easier for you to see them, but I would still be careful for your sake and theirs.
Thank you. So we're down to our last 2 minutes. I'd love to just open it up for any thoughts from our panelists. I know that there were a number of questions that we did get to and some that we didn't. So certainly we at the American Heart Association commit to keep this dialogue going with all of you. But with that said, thank you for being here. And Dr. Renteria, why don't we start with you? Any closing thoughts?
Well, I just want to say that we need to get vaccinated, all of us, and get all the people around us in our communities to get vaccinated in order to prevent a third wave, I would say. We really need to get the vaccine. So let's go and fill up the social media with reliable information that we can trust. And I was looking at the questions, and American Heart Association has a great page with all the information, and we can look for resources that are reliable, like American Heart, like Mayo Clinic, like the CDC, and read about them, and they are really easy to understand. So the vaccine is the best in this time of distress, I would say that.
Wonderful, thank you. Tochi, any closing thoughts from you? You're muted.
Just like Dr. Renteria said, get vaccinated, get those around you to get vaccinated. If you get vaccinated, be proud of it, show everybody else around you and encourage them to do so. And if you have any specific questions, please reach out to your physicians. I think all of us are trying to get our patients vaccinated and are very interested in advising our patients accordingly.
Thank you. Jason?
Yeah, I'd have to echo the same sentiment, just encouraging everyone to make sure they get vaccinated. I think the headline is around just really proud of all the efforts across all of healthcare, really, to be honest, really making amazing progress out there, but it really takes everyone to continue the due diligence of masks, hand washing, etc. But just really proud of all the efforts and happy to join to circle back to keep everyone informed. I think that continues to be a priority.
Great, thanks. And then Don, last word goes to you.
I can't say it better than my co-panelists just said it. I'm really proud of what's been accomplished by the health system, and what we've learned during this year has been just incredible. We can't do it again, so please get your vaccine. It's been a rough year, I think, for the healthcare system, and so please do get your vaccine. Please do protect the weakest among us, and make sure we don't break the healthcare system. Tochi said it best. Get with your doctor if you have any questions or concerns at all.
Wonderful, thank you. Well, one final thank you to our tremendous panelists. Appreciate you committing the time today, and thank you to all of you for joining the conversation. We hope that you stay warm and healthy. Take care.